Welcome, everyone, and thank you for joining us for this webinar, Finding Resources, as part of our webinar series on coping with dementia care during the coronavirus pandemic. I'm excited to learn from our presenters today. Amanda Lee is a social worker in the Memory and Aging Center Clinic, and Jennifer Merrilees is a clinical nurse specialist at the Memory and Aging Center. I know they handle a lot of the resource questions that we get here, and they also are part of a network to stay up to date on what's available. So during this presentation and during the question and answer, please feel free to type in your questions in the Q&A box below. If you hover at the bottom of your screen, you'll see the Q&A icon, and that's where we'll be taking questions in the last part of the hour we have together. And without further ado, I'm going to go ahead and let Jennifer and Amanda introduce themselves. Thanks again.
Great, thank you, and welcome everybody. One of the first things I want to do is that we've put a lot of resource titles and we've put a lot of website links in our talk. I don't want you to worry that you can't have time to write them down. We're going to have a document available with this recorded webinar on our website. We'll give you that link for sure. So you'll be able to find all these resources as we move along. So I'll introduce myself first. I'm Jennifer Merrilees. As Sarah said, I'm a clinical nurse specialist at the Memory and Aging Center at the University of California, San Francisco. My clinical work and my research focuses on family caregivers. Amanda?
My name's Amanda. I'm a social worker at the Memory and Aging Clinic. I kind of just help out anyone that we usually get at the clinic, and we just divide up tasks and kind of see what's going on and help people navigate the complex systems that we have in place.
Great, and just to remind everybody, this is the mission of UCSF, sort of the reason that we're here, for caring, healing, teaching, and discovering. What we're going to cover today, we've got some broad categories. They're here on the screen. So food, household and personal care items, medications. We thought we'd touch on some financial and legal concerns and where to find resources, in addition to housing and utility questions, and then some supportive resources really designed for our caregivers. So let's talk about food. And some things to really consider about food is to first think about, there's been a lot of talk and a lot of worry about people hoarding supplies and food. And so the recommended supply that we all keep on hand is around a 2-week supply of food. And when you think about the type of food that you want to have available, don't forget non-perishable items. And don't forget to include the items that you enjoy, because this isn't necessarily a time that we want to really deprive ourselves. There's a link here. We'll make it available to you again in a document at the end of the talk on our website. But Consumer Reports has a really nice article outlining some of the safe practices to take while you are shopping for food. And I think one of the overall questions right now, especially for seniors or people that have compromised immune systems, is this a good time for you to be shopping? So we're going to talk about that too, and sort of talk about different alternatives that you may or may not have considered already. So one of the things to consider is that a lot of grocery stores in response to the pandemic have set up sort of special shopping hours for older adults and people with compromised immune systems. Time for them to go into the store and shop and hopefully be able to social distance more and not be exposed to crowds of people. A lot of the major food chains have started these senior hours, these special shopping hours. You need to look at your local store to really confirm the hours. So majority of them have these shopping hours in the early morning, or they might do them on certain days of the week. Some do it all days of the week. So you really want to look up the store that you want to shop in and either call them or look online and see what their shopping hours are. And then I think the other thing I'll just say about this is that there have been some news coverage showing lots of crowds and people lined up to try to get into stores, and even during these special shopping hours. So I think you also want to just sort of be safe, and if you go to your store and you see that there's actually long lines and maybe there hasn't been a good line system put in place, you might want to avoid it and try back another time or try a different store. So again, sort of take caution, and I think each store is a little bit individual on how they're rolling this out. There's other alternatives to going inside your grocery store. And so again, lots of links here, but these were some of the larger stores that we found are doing this. So they have what they call a curbside pickup. So you can phone in your order or make your order online, and then the store will tell you what time to sort of show up, and somebody from the store will walk out and help load your groceries into your car. So that's an alternative, again, to actually going into the store. And then this idea of whether it's actually better to think of someone else shopping for you rather than you doing it yourself. And so some of the ideas are within your own sort of circle, your own network. Are there family members? Do you have neighbors, friends? Do you have help from an IHSS caregiver or home care attendant? And would it actually be better to ask this person to do the shopping for you? And then there's other organizations that are providing sort of help in connecting people to shop for you. So Nextdoor has been around for a long time. It started here in San Francisco, but it exists now in 11 different countries. Not available in all locations, but most neighborhoods do have a Nextdoor that you can sign up for and become a member of. Usually I don't think there's any charge for it. And it might be a way to sort of match your need with somebody in your neighborhood who's willing to help you with things like shopping for groceries. I've gotten some feedback from people that are using Nextdoor that it's also become a forum for complaints and some angry comments about the pandemic and about other issues. So you just want to be aware and kind of monitor your use of it accordingly. But again, that is an option. If you do have a Nextdoor in your area, that might be a way to find someone who might be able to do some shopping for you. Mon Ami, or My Friend, is an organization in the Bay Area. It matches a volunteer with a senior. A lot of the services that they have include supportive phone calls, maybe some help with grocery shopping, and then they have lots of other activities that involve more in-person connections, which are sort of on hold right now, but it could also be a way for you to get help with grocery shopping. And this is available in multiple counties in California. Shanti has a variety of supportive programs. Again, I've got the website there. And again, like Mon Ami, could include supportive phone calls or help from volunteers to help deliver food. And then there are mutual aid programs that have been cropping up. And the one that's been in the news right now has been in Oakland. Oakland at Risk Match, and so it's an example of a program where they match people in the same neighborhood. I've heard that sometimes people that live in the same apartment buildings are being matched. So they match someone that has a need, like say maybe a need to go out and do grocery shopping, with a volunteer who can help. There's other mutual aid programs here in the Bay Area. There's an East Bay Mutual Aid and a South Bay Mutual Aid. So I think if you weren't sure if you had one in your county and were interested in looking into that, you could perhaps do a search, a Google search with the term mutual aid, and see what comes up. Other food delivery options, some that have been around forever, and some are getting a lot more sort of traffic now. Instacart is an online service. It's not available in every location. But if it is, the way Instacart works is you make an account online. It will show you which stores are in your neighborhood. You can pick a store that you normally like to shop at. You can pick out your groceries and fill your online shopping cart, and then ask for a delivery time. So I think when pandemic first started and people were using Instacart, you could get your groceries delivered sometimes that same day. There's now a delay. Sometimes it can be about a week. So you just want to think about that when you're planning planning your food and planning your meals, that if you were going to order on Instacart, you have to expect about a week from the time you place the order between the time that it is delivered. Meals on Wheels is an organization that's been around a long time. I think they've gotten a lot busier during this time, so they provide meal delivery to residents that are having difficulty leaving home. And again, what would be important if you were going to get on Meals on Wheels and start using that is to really identify if you have certain preferences or needs that have to be accommodated. We've heard some stories that people were delivered frozen food and without realizing that the person actually didn't have a microwave or a good way to sort of heat up that food. So again, if you were going to use them Meals on Wheels, you want to make sure that they know of any special needs that they should accommodate. Project Open Hand offers meals and grocery delivery in San Francisco and Oakland. And then there's other meal delivery applications in addition to Instacart, such as Uber Eats, Caviar, Postmates, and DoorDash are all different apps now that have gotten a lot busier in terms of delivering food from grocery stores or from restaurants. Other alternatives to grocery stores are food banks or pantries. They are offering free groceries, and there's a national website that we've listed here that we'll have available for you, and you can search by your state or county. The word that I've gotten that I think we've heard from different food banks is that their demand has really gone up for this service. So they were really trying to fill a lot more need than they did before. But that is one option. And then another option would be these community-sponsored agriculture, or CSA, where you buy directly from local farmers. And these have been around for a while in certain neighborhoods. And from what I've heard, that their business has actually been really increasing during the pandemic. So you create an account and you pick the size of the CSA box that you want. I think that's normally like a weekly delivery of fresh fruits and vegetables from a local farmer. The delivery is typically at some drop-off in your neighborhood, so at someone's home who's volunteered to do this, or at a business. And then we've given you a couple of, we've given you the Local Harvest CSA website that you can search to see if there's a CSA farm in your area. And then also the USDA has local food directories, and we've given you the link there to sort of search in your neighborhood to find out more about CSA and whether that might be a good way for you to kind of meet your nutritional needs these days. Some additional tips to sort of think about, and there's more than which is on this slide. If you do go to a grocery store, try to group your purchasing, make as few trips as possible. This isn't a good time to go back and forth for one or two items. This is a better time for trying to go to the store once or twice a week and try to get as much as you can on that trip. I've read some articles that have recommended that you try to shop alone because this minimizes the number of people in line and in the aisles. So if you're able to do that, try to go alone, which is all part of this practicing of social distancing. And then probably by now people have heard that it is recommended if you go out in public to wear a face mask, and we're going to touch on that in just a minute too. Disinfect the shopping cart. Most grocery stores are trying to keep a good supply of the wipes out in front of the store to wipe down the handles and parts of the shopping cart. Try to use touchless payments, so use a card rather than cash. Again, it's just everything that you can do to kind of limit your exposure when you're out in public. And then there's also some tips for handling your groceries once home. And this is sort of when you think about bringing your groceries home, or if your groceries are delivered. And there was a pretty comprehensive article on NPR, which we're going to give you the link to here, that sort of talks about sort of what's an appropriate way to kind of clean off your groceries when they're in the house without getting sort of too carried away. So let's talk about household and personal care items. This has come up a lot during this pandemic. And again, here's an article about how to think about cleaning and disinfecting your home. Part of making sure that you have a 2-week supply of food ready available is to think about household items that you want to have a good supply of and not run out of. Again, you don't want to hoard, that's not the point, but the point is to be sort of prepared to try have enough supplies that you need to keep your home clean. And then there's been also on the CDC website tips on mask safety, and there's been lots of material now about how to make your own mask, but the CDC website has been a really good place to go for most of this information, so we've given you the link there. And then toilet paper has been in the press a lot, and there's been a lot of talk about people being nervous about running out of toilet paper and sort of concerned that maybe people are hoarding toilet paper. And I think, you know, in general, you know, you want to keep a 2-week supply on hand. I think most people, from what we've heard, may go to the store and find that these sorts of supplies are out, but go back again another time and things have been restocked. That I think some of the stores have shortened their hours, maybe closed a little earlier at night so that they can spend more time with their employees of staffing these products. So again, you can check store websites for availability. If you're running low and having a hard time getting what you need, you could reach out via social media, again, Nextdoor or on Facebook, to find out how people are finding these supplies or if they have anything to share. And then if you're having trouble and your store that you shop in is not supplying the products very well, maybe talk to the store employees and find out when they expect a new shipment, and then try to time your shopping to that. You can try ordering items online. Amazon has been prioritizing sort of both their supply and their delivery of essential items, which they've defined as medical supplies and household items. I think what we're still hearing, though, is despite that prioritizing, there have been some delays. And I think part of that is getting supplies in, but also that a lot of these companies are trying to practice social distancing. So they want to make sure that their employees can practice social distancing at work. So again, those are all things that may change how they prioritize work and how sort of speedy they can be in terms of delivery. And if you're looking specifically for adult incontinence supplies, we've given you a couple of ideas, North Shore Care, and a couple others here that specialize in incontinence delivery and that you can look at for ordering online. And then think about alternative products. So, you know, toilet paper is sort of the ideal product, but if you can't get toilet paper, is there a way to get pre-moistened wipes or even dry wipes that you can wet with water or a mild soap and use in place of toilet paper? And then other alternative products that people have talked about and I think have been using is spray bottles, which you can order on Amazon or I think some of these other suppliers. And then bidets, and the photo we have here is more of a sort of a single standing bidet, but a lot of the bidets now are more portable and are actually a device that sort of clips onto your normal toilet. So these are other options too for personal care if you're worried about toilet paper. And actually, even before the pandemic, we had a lot of our families were switching for their loved ones, switching to these sorts of alternatives because they found that they were just sort of easier in general for managing personal care issues. And one other thing I should have mentioned before about the wipes on the previous slide is they can't be flushed down the toilet. And sometimes some of these will say on the box that they are flushable, but from what we've heard from lots of different sources is that they're really not flushable. So they shouldn't be flushed down the toilet, but disposed of in the garbage instead. We're going to switch to medications now, and Amanda's going to take over at this point.
So medications has been a pretty hot topic that we've been hearing a lot from a lot of our patients at the Memory and Aging Clinic. Some things that we recommend is having a 90-day supply. What that means is that you have a 3-month supply, but it also means that you will likely have to ask your prescriber to make sure it's a 90-day supply for that to be filled correctly. Pharmacies are open at this time, but due to the increase of like size of like prescriptions and things like that, there is a little bit of delay in getting like refill authorizations, but they are doing their best and they're trying to also fill medications in other ways. You can also ask someone to pick these medications up for you. So having a caregiver or someone who's not in the vulnerable population, considering your in-home support service caregiver, or hiring a home care attendant, things like that would be really helpful to have this medication brought to you rather than going out so often. The other thing that we notice have been really helpful for some populations, if they're not able to leave their loved one at home or they don't have enough help, is considering going to a pharmacy that has a drive-through service. So that way, you're still in your vehicle, there's like very minimal contact. Next slide, please. And the next one that's becoming much, much more popular that a lot of our clients and their families have given good feedback was mail delivery options for medications. Some that we've noticed have been really, really beneficial in 2 ways is Amazon pill packets. So the medications get delivered to your door and they also get individually packaged. So it also promotes like a little bit of a task for the individuals. So that's something that we've noticed have been really beneficial. Other ones are like CVS. They offer free packing and free delivery, which is really amazing. So they have all the medications all set up for you and they have it shipped to your home for free of charge. Express Scripts is another one. This one takes a little bit longer, but they also do have packaging and delivery. Safeway has been ramping up their home delivered options, and they offer free packing, but there is a delivery charge of $10.50. Walgreens is another popular one for free packing, and it's about a $5 delivery fee. We included the websites here. That way, if you do it online, you can make sure your medications are being filled on time, you're getting the 90-day amount, and it's just a really great way to prevent going out and having more contact. One thing I do want to mention, though, is that you want to make sure that your insurance is contracted with these pharmacies, because we don't want you to start using them and have a large copay if they're not contracted. We're going to talk about financial and legal concerns. This has been a topic that's been coming up pretty often. Some things that we do recommend, especially with COVID-19 going on, is what is SDI, who qualifies for it, explaining what paid family leave is, and unemployment. So SDI is if you're sick or you're quarantined. So this is usually recommended or prescribed by your provider, your medical professional. So you would be applying for disability because you have a diagnosis of some sort. Paid family leave is also another way to have some kind of funds for your caregiver. So if your caregiver has to be at home to care for you, they have an option to apply for paid family leave. Unemployment is if you have reduced hours or laid off. So a lot of people in the service sector right now are applying for unemployment. I do want to point out that due to the high demand right now, there is a huge delay that we're hearing as feedback. The other option that I've been hearing is some of the larger companies do have paid administrative leave. Those ones, I do encourage you speaking to your HR to see if you may qualify for it. That way it might be a good transition during the time to figure out whether or not you would qualify for unemployment or other forms of financial support. The last thing that's fairly new on the financial part is the economic impact checks / stimulus checks that everyone's been kind of talking about and we're hearing about on the news. I do recommend going to the irs.gov website. They give a lot of really great information about who would qualify and kind of when to expect your checks. Some things that came up that were really great was if you're a retiree or SSI recipient, you do still get a stimulus check. There are no extra steps that need to be taken in order to qualify. One of the big things that I do want to point out is looking at the specific amounts that they identified on the website about who may or may not get it. Some financial concerns regarding banking. We've been getting a lot of calls about kind of, having these bills that are due, but no way of paying them. So one thing that we want to do is encourage you to talk to your lender, your loan servicer, to ask them, hey, is there anything that's going on, anything available to me to help me during COVID-19? During this time, a lot of the banks have become a lot more lenient, and they have, specialists that are kind of advising on how to best approach these situations and what may be really beneficial for each individual based on their circumstances. So the recommendation here would definitely be to contact your lender. Health-related concerns. So according to the Coronavirus Aid, Relief, and Economic Security CARES Act, right now, Cover California has extended their open enrollment until June 30th, which is really great because it's a great opportunity to sign up and make sure you have coverage in the event something does happen. Another thing that's going around right now is that testing is available for everyone for COVID-19. However, with that said, we always recommend talking to a primary care physician before driving up to one of the sites and things like that. And that way we're making sure that, we're getting the answers, the correct answers, correct questions answered, and we're not overwhelming these drive-up sites. Something to also point out is that Medicare has relaxed some of their requirements. So they're now including some telehealth visits to make sure people are still getting their concerns addressed at home. As well as something that's kind of interesting is that they've relaxed their qualifications for transferring to nursing homes. So for example, before each person would need a 3-night acute overnight stay at a hospital before they can go to a skilled nursing facility, that has been relaxed. So that's really good because, we're trying to also limit the spread in that way. Housing and utilities. So according to the CARES Act, right now they've also relaxed the renter restrictions and evictions, and we've increased the protections for the renters. So in San Francisco specifically, they've issued a 90-day halt to evictions if a tenant cannot pay due to COVID-19. Here, we do recommend checking with your local county, contacting your local adult and aging services, and asking them if there's anything specific to each county that is available. So this is kind of a county by county regulations. Next, we're going to talk about if you're an owner or worried about your mortgage. So federally, we're having a federally backed mortgages where evictions are halted for 60 days. So here it's just a kind of a federal, US-wide kind of act that's going to slow everything down just because there is a delay in, getting stimulus checks, a delay in jobs and all that stuff. So again, we encourage you to talk to your lenders and let them know that you are experiencing some difficulties due to COVID-19. The next thing we're going to talk about is about paying for utilities. So California has a statewide policy right now to kind of help. So they're helping with reducing the costs. I'm sure you guys have probably heard about car insurance companies offering a little bit of a refund. So there's a bunch of places that are just offering kind of small refunds or adjustments to prices due to difficulty paying. So there, you do have to call your utilities company to let them know that you're having that difficulty. Most of them don't do it automatically, so we encourage you to give them a call and let them know that you're having some difficulty and letting them know that you still need these services, but you just need a little assistance this month while you're waiting for other things to fall through. So again, check with the supplier, the insurer, and see what other local incentives there might be. Supportive resources. Right now, a lot of the services are not in person. They're all online or over the phone. I know this is not ideal for socialization, and it may be a little bit difficult, but some ones that we do have available right now are through the phone. So there's a lot of friendship lines and kind of support peer lines that are available. There's also some websites where they have activities that are kind of in a more kind of group setting, similar to the Zoom calls that we have, that offer kind of tutorials and things like that. So I've included here a bunch of them, and we're going to have a tip sheet online about more that would be available, but they change so frequently, so we're going to try our best to keep up with it as much as possible. Some main ones that I do want to point out is the Institute on Aging has a 24-hour friendship line. It's really great. I've heard amazing feedback that it's a nice way to have someone to talk to, especially for those that live alone or don't have family that can visit daily. So that's a really great one. Alzheimer's Association has an amazing one for caregivers. So this is a helpline that's available 24 hours a day, and they can kind of talk you through difficult situations and kind of give you tips on how to support your loved one as well as supporting yourself. Another one that just recently came up for Spanish speaking is the National Disaster Distress Helpline. They've really ramped up their support to help during this time. So they can be available over the phone as well as text. So that's a pretty amazing development recently. Again, there's an amazing website here about tips during this time through the Alzheimer's Association. Lastly, we just always want to point out self-care is really, really important. We want you to remember to take care of yourself. You know, we want to encourage you to use the helplines. We want you to encourage you to reach out to family, friends, neighbors, anyone in your network, just so you can have a break, since we're all indoors and the impact of this has been pretty rough on both our loved ones as well as the caregivers. So we definitely want to always remind everyone the importance of self-care. And lastly, for acknowledgements, we want to acknowledge the Memory and Aging Center here at UCSF, as well as UC Hastings. They've been really helpful in helping develop the resources and information about this topic. And then we're going to open it up for answering any questions that you might have submitted through the Q&A box at the bottom of your screen.
Thank you, Amanda and Jennifer. I don't see any questions yet, but I had a couple of questions that came to mind while you guys were talking. One is when a child is concerned about their parents and they feel like their parents are not acknowledging the risk to themselves, like maybe their parents have a comorbidity that puts them at higher risk and they're still going out shopping. Or they want to go out shopping, and even though the child is doing the shopping for them, they still want to go out. So I wonder what thoughts you have about how child caregivers who maybe don't live with their families can deal with that.
Yeah, I can start first, and then I think Amanda will probably want to chime in. Yeah, I've heard of this in several situations, and what the adult children have ended up doing is they've gone ahead and ordered groceries and had them delivered. So rather than kind of waiting for permission to do it, but say, this is something I really want to do. I want to do something to help you, and this is my way of trying to help you stay at home. And so they just go ahead and have the groceries ordered and have them delivered, or arrange for some sort of delivery to help sort of encourage the parents to stay at home. I think it is tough. Everybody seems to have kind of a different idea of vulnerability and sort of, taking the pandemic seriously. It sort of exists on a range. So I think sometimes just going ahead and not waiting for permission might be, and just say, this is a gift I want to give to you. And for me, would you stay home and let me just order these groceries for you, might be sort of one strategy. I don't know, Amanda, did you have, I want to make the point too, maybe related to this, is something that Amanda said, that I think what we're seeing is that these resources are changing rapidly. So it's hard to keep up with every change, which is why you want to check with local sort of resources and services. Even the CARES Act, we are giving you information from this CARES Act, but we're expecting that Congress is going to make more changes. So again, you just try to stay informed, stay in touch with your lender, stay in touch with your landlord about things that you might be concerned about. But going back to the question about how adult children might help incentivize their older parents to stay at home, did you have any other ideas, Amanda?
I completely agree. I think one thing that's really an amazing thing that we can do that doesn't always require too much effort is reframing where we're coming from. So really reframing why we're saying, hey, stay at home, and saying, we're really worried about you. We want to make sure that you're staying safe. So this is something that I want to help you with. This is something I can do because I'm not local. That is really great advice. Other things that I would recommend is still encouraging them to go outside and get some air. I think cabin fever is very real, and making sure that we're practicing social distancing, but maybe going for a walk or having them have a task every day, like going around the block or going 2 times around the block, things like that. But also I do want to point out that on our memory and aging site, there's going to be some webinars on like in-home activities that can be really beneficial to kind of provide some simulation. So that might be something to talk to your parent about, is, hey, have you considered trying this? Or, hey, maybe cleaning the backyard, or cleaning out the garage. That way there's still like a change in environment, if you will, but still staying in a more kind of secluded area.
Yeah, so along the same lines, we have a couple of questions. One is about advising older adults to take walks outdoors, and if there are any precautions that that they want to be aware of. This topic has come up before, where people with dementia who don't have insight might not be very great at social distancing, and then for those who might not, might really live in dense, crowded areas where it's harder to social distance, if there's indoor physical activity resources or ideas.
Great question. Yes, I think it gets a little bit difficult. We still want to point out, like, hey, everyone's kind of wearing this, kind of making it a trend. So hopefully that'll be beneficial. And also the other thing we can talk about is like kind of driving out somewhere that it's a little bit more, a little less dense. That way there you can still freely roam a little bit. I know that a lot of parks have actually closed down, but to areas that have less foot traffic would be another option. As for activities indoor, absolutely. We are definitely developing a list of all the free services that we can find that are indoor for exercise. So look forward to that coming on our website. And there's also, there's still in our slides, there's like the Memory and Aging Cafe. That is a really great option. I heard that going to be starting on things options for online size, and there's going to be other online options too. So we're going to make sure we update a little bit of a worksheet so everyone has that available.
Yeah, I agree with everything you've said, Amanda, and I think too, I've given this advice to some people too around the social distancing, is think about, is there like better times of the day to go out when maybe there's less people? I love your idea that, maybe can you go somewhere where it's going to be less dense? Can you take a drive instead? But I think also kind of paying attention to kind of, are there rhythms in your neighborhood where there are less people out, and maybe that would be when you'd want to go for the walk. I think in most neighborhoods there tend to be some of those natural kind of rhythms to the crowds, and so to maybe pay attention to that is possible too. And we talked about this recently around some of our patients and caregivers, and kind of thought about maybe there are certain cues for our patients that may not appreciate you know, the need to social distance. So if people are wearing masks, if you as the caregiver wear a mask and encourage the patient to wear a mask, maybe that's like another cue that these are sort of different times, and people out on the street are wearing masks and sort of not, you know, touching and hugging the way we used to. And just think about the kinds of cues that you might be able to give to the person that would help kind of reinforce more of these social distancing practices.
Thanks for those ideas. I did want to just add that from last week's webinar, there are some links in the summary to exercise videos. Our team has struggled, you know, none of these are really designed intentionally for people with cognitive impairment. So they do need, I think, a caregiver to help engage them in these activities. But some of them are pretty good. I also think just turning on some music and dancing around the house a little bit, you know, dancing down the hallway to the bathroom, just kind of incorporating a little bit more movement and some playfulness in your everyday activities can be helpful. The resources that came to mind immediately were the Sit and Be Fit videos, which are a lot of them available on YouTube, and then the NIH Go for Life. They have, I think, 3 or 4 videos that are vary in length, like 10 minutes, 20-minute long exercise videos. There's also Silver Sneakers has some videos online. So those are just some online resources. The other question we have here is around spouse with Alzheimer's who is not eating anymore. And I wonder if you want to comment on the kinds of, what might be contributing to that and ideas around responding to that.
I guess it'd be nice to, or maybe for the caregiver that wrote this question or who's experiencing this, to think back to when did this start? And is it sort of associated with other changes, perhaps medication change? Is it associated with, did your schedule and this person's schedule change a lot with the pandemic? We've had a lot of patients whose day programs have closed, so now they're home all the time. There's been disruptions in having sort of the people that come into your home to help you with care, like aides. So can you link this slowing of eating with any other sorts of changes, and sort of think about that? I think sometimes not eating could be a sign of a medical illness, that perhaps this person is feeling sick. And so I guess I would want to also have you talk to their doctor to get those ideas, and maybe get a telehealth visit if you can't go in person, go over medications with the physician, things like that. But I'm wondering if, I think it's possible that if the schedule has really changed and maybe this person doesn't have access to the sort of meals are about the food, but they're also about kind of the social setting often. So if this person was normally getting foods in a day program, maybe part of what they're missing is sort of that piece of it. So I would kind of explore, are there any other things that are kind of associated with this change? And then are there any things that would make you suspect like it could be a medical problem? Is this person complaining of nausea? Are they rubbing their stomach? Are they losing weight? Things like that you'd probably want to involve the doctor. But I wonder if Amanda or Sarah had any other thoughts about it too.
I actually think you summarized it really well. Is really taking a look at the social environment and seeing if anything changed, and if something did change, kind of responding to see if there's anything we can kind of adjust to mimic what it was before all this happened. And again, if there was any reason medically that's going on, we definitely encourage you to reach out to your medical professional and follow the instructions they give you, just to make sure that we're rolling out any physical concerns or any medical concerns.
Yeah.
Yeah, great, thanks. And along the same lines, I guess if people are, you know, have less access to food or maybe aren't eating as much, are there things that they can eat that are, you know, maybe more nutritionally dense or higher calories? Like, is this a time where you really try to push, you know, peas and carrots, or, you know, what are the kinds of things that you would recommend trying to get someone to eat who's not eating very much?
Yeah, I think it's a good point. And I think, you know, going through these sorts of times that are, of course, very unusual, but also, you know, associated with a lot of stress. Maybe this isn't the time to really try to deny yourself, but to go ahead and eat the things that you enjoy. And maybe for in this case, to think about, are there certain snacks that maybe this person would be more comfortable eating right now that yeah, that you could supply to them and not be so worried about. I think that's the point that you're getting at, is maybe this isn't the time to really be very disciplined necessarily, but you know, within reason, maybe to focus on things that are perhaps more enjoyable.
Mm-hmm.
Again, is there a chance to make the mealtime more enjoyable and more pleasurable? And I think one thing that I've heard from a lot of different caregivers, is that they've realized that they've been so focused on the news, and listening to the news right now is a way to get information to stay up to date, but it's also can be a real source of anxiety. As I've had several caregivers say that they've really had to monitor how much the news is on and how much the television or the radio is on with the news. And so I think the same would go with our patients too, that if you're feeling anxious and the room is full of the television and the radio sort of expressing a lot of concerning sorts of issues, I think our patients pick up on those emotions too. So I would look at maybe the whole environment and think about ways to sort of lift the mood, and hopefully make people feel better, and maybe that would help to sit down and eat and enjoy a meal as well too.
Yeah, thanks. We could talk about this topic for a full hour. So
Good. We could.
And so if that person who asked that question has any other additional questions based on the answers you've gotten, please feel free, because we could really talk about that some more. But I had another question. Amanda mentioned Covered California has extended their, I think you said open enrollment. And for people who might not know what that means, you know, what does that mean if someone lost their job and maybe lost insurance that they had in association with with their job, or they were kind of feeling like they were okay without insurance before, and now that there's a pandemic, they're kind of feeling like maybe it's not so safe to not have insurance. What does this Covered California open enrollment mean?
That's exactly it, is that if for some reason you don't have insurance, or you know, might have lost your insurance because you're now not working, it's an opportunity for you to apply for some kind of coverage, and it just gives you an open opportunity to apply, like to choose a different type of insurance coverage, or seeing what you may qualify for under government assistance. So a common question we often get is, would someone be would they qualify for Medi-Cal? And it's based on your income, so there's something to think about, but also just a great opportunity to make sure you have some kind of insurance coverage should you start to feel ill. So it's just an opportunity for you to go to a website, fill out the application, and get some insurance coverage outside of the normal open enrollment, which is later in the year.
And so it's not the same as applying for Medi-Cal, though.
So Covered California, based on what the information you add in, you may actually automatically qualify for Medi-Cal. So they will pump out that result for you based on the information that's provided.
Okay, great. Yeah,
Yeah.
that's good to know. And let's see, what other questions? So again, I think you covered some of this in the talk, but if someone is concerned about not being able to afford to pay their bills, like they have a credit card bill that they've been meaning to pay off, or you know, a mortgage payment, what are your recommendations for them?
Recommendations would definitely be to reach out to your lender. So I'm just going to use like, student loans for right now. Right now, if you contact like your student loan provider, they're postponing the amount that's due, as well as like any interest rates. So talking to them and being like, hey, I'm not working. I know that you guys don't have any interest right now, but I can't afford it because I'm not working. So they are willing to work with you. With that said, every lender is slightly different. So that's why we definitely encourage you to reach out to each lender to see what kind of support they can provide given the pandemic right now.
Yeah, I think one of the main points, I think Amanda made this earlier too, is that you just need to really communicate with your bank or your lender about any difficulty that you're having so you can make arrangements. So I think that could be a little bit of a misconception that the CARES Act meant that, people don't have to worry about paying their rent or they don't have to worry about their mortgage. And it's really that there's some relief and there's some time to let people try to get back on their feet, but it doesn't relieve you of the obligation that you need to let your landlord or your lender know that the difficulty that you're experiencing, so you can at least enter a dialogue with them about what the next steps could be.
Great. And you probably also mentioned this, but in terms of if you wanted to get medication delivery, like say from Walgreens or CVS or wherever you get your medications, you mentioned going online. Is that the best way to set up delivery? Because from what I've heard, the pharmacies are really busy, as you said, because people are filling a lot more prescriptions. So they don't, seems like in person, they might not be very eager to help you with that.
Yeah. So what's the best option? We definitely,
What's the best way to set that up? Yeah.
Yeah. From what I've heard from different pharmacists is that the best way is online to ensure that everything is done properly. And that way they have it in their queue to get everything kind of situated. And after the doors are closed, they still are filling those medications. In person, it may be a little more difficult because with the increase of prescription requests, they are delayed there. And we would also want you not to have to stay in the store while that's getting filled. So I hear online's, ideal. Phone is still okay, but online might be a little bit easier to get everything done. And that way you have your regular updates of making sure it got submitted and any updates that you might have of, hey, we delivered it out. So more seamless.
And in terms of, it sounds like part of that too was communicating with the provider to make sure that the prescription is written for a 90-day refill. Is that what you were saying?
Yeah, that's so I spoke with a couple of our pharmacist interns and they mentioned that that would be the best way to go about it, just to prevent the prescription may be filled for less than 90 days. It's just to make sure to have a note in there.
And I think reminding for people to remind their doctors who are prescribing the medication to write it for 90 days, because I think sometimes what I've seen too is that the physicians just sort of forget, or they write it for a month with 12 refills, and what they really need to do is write it for 90 days with refills. So also reminding your physician that this would help you out right now could also be part of this part of the process.
Another challenge I've heard from people is when they order groceries for pickup, if something's not available, and I've experienced this myself when I go shopping and I think I'm going to get one thing and then I go and that thing is out of stock and I have to, change my mind, but I know what I will want to eat. So, people are either not getting those things or they're getting an alternative that's not what they would have chosen. I wonder if you're having someone shop for you, do you have any ideas on maybe they make sure they have your number to call or how to kind of navigate that kind of
supply? No, that's a good question. It's a good issue. I think on something like Instacart, which I've been using for my, we've been using it for our father-in-law. If they're getting low on an item, when you're going to put it in your shopping cart online, it'll say, this is low, can we suggest an alternative? And then they have some choices, so you can kind of make that decision. But yeah, if you had somebody else shopping for you, you might want to just sort of specify that if you can't get this brand, or in the, the quantity I can afford, then I'd like you to skip it, or here, maybe sort of set out those preferences with whoever's doing the shopping for you. But I think the online, at least what I know from Instacart, is that they, if they're worried about being low, you kind of automatically get these other options that you can pick. Yeah.
Great. And then one last question. I think, when we're all trying to shelter in place, we maybe are not having access to ask these questions. So if someone were dealing with a change, like we had one question about someone not eating anymore, and if someone who used to be able to go to the bathroom is starting to have accidents, what are the kinds of things that you would recommend for someone who's just starting to have incontinence accidents?
I'll take the first stab at this one. I think when something is new, I think one of the first things, like the earlier example of not eating, would be to look at, are there any other changes that might be associated with this? So did the person have a medication change? Do they have a really different, unusual change in their routine that is maybe affecting their function in this way that they, are having accidents? Is it that they, is their physical mobility sort of impacted in a way that they just can't get to the bathroom on time? So sort of looking at the whole context of what's going on, or was this a problem that's been sort of gradually increasing? So maybe the person was infrequently having accidents and now they're happening more often. So I'd really look at sort of the full picture of what's going on. If it's more sudden, like within the last few days, I'd be worried that it could be a medical reason, like a urinary tract infection. So I'd want to encourage you to be in touch with the person's physician and talk about whether there could be a urinalysis, get a urine sample and have it tested to see if there's bacteria in the urine, and look at, are there other things going on? Is this person sort of less active? Are they sleeping more? Things that might make you think that, yes, this could be sort of more of a medical illness versus this is a response to a change in their normal routine.
Great. So if there aren't any other questions, I think we're getting close to wrapping up. So please type in your questions in the Q&A box below if you haven't already. And the other thought is, there was a question about when the video will be available on our website. So we try to post it as soon as possible. Our goal is to get it up, later today, which is very idealistic, probably tomorrow or the next day, but our goal will really be by tomorrow. And for those of you who wanted to know about the resources and links, those will also be posted on the website, which is listed here, memory.ucsf.edu/COVID. And we also want to remind you to join us next week. The topic will be staying connected while sheltering in place. And we actually have a lot of interesting guest speakers for this topic. So Richard Caro from Tech Enhanced Life. We also have some of our own IT people who will be helping answer questions around, we're all using technology more, and they'll give us some tips on best practices for using technology these days. And we'll also hear from a family member who's staying connected with his mom in a nursing home and how he's managing to do that when they can't visit in person. So thanks again for joining us, and feel free to share our website and these webinars with others. We want to help as many people as possible. So thanks again, and thanks to Jennifer and Amanda. You guys did a great job.
Thank you, everybody.
Thank you.
Everybody stay safe and healthy.